We're not being recorded, are we?
We may just leave
everything recorded these days.
Okay, well, what are we doing today, you guys?
I don't know. I think we're talking about healthcare, something like that.
Don't we usually talk about healthcare?
Yeah, but it's so complicated. It's hard to talk too long about it without making sense.
Well, I think the longer you talk about it, the less sense it makes.
Well, we can talk about it. I got to defer to Lisa because if we talk about it, I got to make sure that policy permits it. So.
Yeah. Well, as you know, everything has policy in it, and policy drives everything, especially in healthcare, but all over the world.
No, it's money. Mm-hmm. It's not policy; it's money.
Okay. Fine.
For my podcast.
Nothing works without the technology. So you guys just keep talking.
Reminder, guys, you're all on record.
Whatever happened to taking care of patients?
Yeah.
Talk about
is that what healthcare is about?
Yes.
Well, as the experienced podcaster here, along with Dave Johnson, we have. Do we have any wisdom to share with this group, Dave, about podcasting?
Be yourself, for better or worse.
It's not about becoming a podcast company.
Are you sure we're not a podcast company? 4 podcasts? 4 podcasts a year? 4 podcasts a month? What's the plan?
4 podcasts a month, 1 on finance, 1 on value-based care, 1 on taking care of patients, 1 on finance, and 1 on policy. Oh, that's 5. Did I say 4? Did I say 5?
I think you said finance twice because you probably agree with Dave about everything being driven by money in healthcare, which is not the future we want.
All right. We are here because we're doing a series of podcasts on the most important things that we have to think about in healthcare. We have to think about how do we create value in healthcare? How do we deal with this transformation that we're experiencing, both from a technology standpoint? How do we finance it? What are the financial implications? And how do we think about the policy implications around regulating and supporting healthcare? So with that said, for those people that are joining, if you work in healthcare, this series of podcasts is going to give you a front row seat to the people that are truly doing the work. We're going to be inviting a series of important guests, the people that are truly involved in taking things from small-scale projects or dealing with small ramifications to really scaling it to transform healthcare. Transforming healthcare is a challenge. But I think in 2026, if you're working in healthcare, you realize this is the year that that's occurring. So with that said, we're going to start off with a series of podcasts, 4 per month, 1 on finance, 1 on policy, 1 on value-based care, and 1 on technology and AI. And we're going to bring this together once a quarter to find out what we've learned from the people doing the work and find out the best way to catalyze this transformation in healthcare.
Awesome.
So with that said, let's kick this off. Let's start with where the transformation really has been hitting traction. And that's in this concept of value-based care. You say value-based care, and people have all kinds of reactions, right? They get really super excited because they've been doing it for a while or dreaming about it. They start yawning because they've been, well, what's going on here? Or they just get really stressed out.
Yeah. I think that's part of the problem. It's we have a name issue. And so no matter what it is, it's kind of like if you remember back in the day when people were talking about the greenhouse effect. And it was confusing because greenhouse effect sounds like that's good. It's like, and so the name fundamentally had to change to, oh, this is global warming. This is bad. Oh, that's clearer. I got to tell you, I've been, unfortunately, I've had to be a healthcare consumer, friends, family. I really don't know anyone that wants value and when they're the consumer in healthcare. Yeah.
I want the very best thing. I want you to spend as much money as possible, and I want it right away.
Absolutely. Rather than get the really good MRI, is there maybe the value, the images, they're not as good.
Nope.
But man, let me tell you, it's half the price.
I want good service. I want somebody to know who I am. I want to be able to schedule an appointment. I want to get the best care in the fastest possible way, like I do in every other aspect of my economic life.
But you certainly don't want anyone saving on your care but you. I want everyone else to spend the most amount of money. I want me to spend the least amount of money. That's it.
But that's the problem. We don't know how much money things are. Can you imagine going to a restaurant? They give you a menu and they say, here, pick out what you want. And you'll say, well, how much does it cost? And they say, well, we'll send you a bill in a month or so. Just enjoy the meal.
Yeah.
That is actually how really fancy restaurants do kind of work that way, just to be clear. But they're really expensive. No prices.
Those are out of my league.
I don't know. I think that interestingly, oftentimes the concept is solid in terms of you can have the best actually, and it can actually ultimately cost less. And so it's a little bit different in that regard, but it's just the way that things get done. And that's where I think it's more about performance than value. And it's really about how do you do the things that matter, even if they are expensive, because ultimately it's going to get you a better outcome.
Like we've been doing these demonstration projects. We've been doing these experiments. We've been doing these sidekicks, but it doesn't really transform the enterprise. It doesn't transform the entirety of healthcare. And I think that's the journey people are in.
That's the same thing we're facing with all the AI experimentation going on too. Great pilots, shows great promise, but how do you scale into the enterprise to totally affect outcome, for the patients, which Dr. Silverstein's talking about. So I think, it's so easy to blame regulation and policy in the technology space, but I've worked in government spaces where we had just as many regulations and laws and policies and all that. So I think it's real easy to blame that on why we're so expensive. But I do think it comes down to more what you're talking about, David. There's no incentives to take risks in this particular space. Are you willing to stick your neck out? If it's not life-threatening, which of course there's many things are, and you need to take that seriously. But there's a hesitancy to take risks in the technology space in this area. Happily, I think there's people, even in the AI space, they are happy to do some experimentation, but back to my earlier comment, they're not willing to go full bore on the enterprise yet because they're fearful of what the outcomes may be.
Well, it's also, I appreciate you saying that, Mike, about policy, because people do certainly blame, the cost of technology in highly regulated industries on that regulation. There is, of course, some cost layer there. And there's also, every regulation does have a price tag, right? Without a doubt, the more complicated we make it, but that's not the only factor. I do think that people are afraid of taking risks. A lot of it is because of the structure of, how we pay for healthcare and how it's so expensive in the US in particular, not exclusively anymore. And when the price is like something where you just keep adding, and nothing ever gets more efficient, nothing ever goes down in cost, we never seem to be able to find any of those savings. And the system accepts that continual adding of cost. What's the point of taking a risk? Just add to the price tag. Easy enough, like you're saying.
So Brian made some great points, right? It's not about the word. It's about how do you create value. And value is about everything. It's like, how do you think about the operations of a healthcare system? How do you think about the incentives that are given to the various people? How do you think about the experience that patients have in the journey through healthcare? How do you feel like the experience of people that are delivering healthcare so they love their work and they like taking care of patients? And more importantly, how do you get better clinical outcomes? So, Lisa, I thought policy was going to fix all this. I thought the government would step in and just take charge.
Well, first of all, what government? Because there's the federal government, there's all the state governments, and there's a whole mix of who's in charge of what across the healthcare enterprise, right? And, I would say I'm obviously endlessly fascinated by policy. I've been doing it for some time. And just my own shameless plug for my podcast, The Policy Stack, where we're really going into understanding all of the overlapping different layers of policy from different perspectives, right? From the federal side, from the state side, things that are sub-regulatory, the things that make up, that really drive a lot of healthcare forward. And, giving you an example, just had a conversation with Duncan Reese, who's one of the founders of Iora Health, speaking of value-based care and delivering care in a new setting, talking about a really unprecedented moment in time for the CMS Innovation Center, which is the home of a lot of the federal health innovation, where they released, something like 7 or 8 new innovation models in less than a quarter in basically the end of the year last year. This is a huge amount of stuff
10.
Huge number, right? And it's so much new regulation and policy and sub-regulatory guidance and programs for the system to take in at once. And so, great ideas, but going to be really hard to implement them. And I'm just endlessly fascinated by this policy and implementation pipeline, which often falls apart, right? Good policies, well-intentioned policies implemented poorly or don't have the resources for implementation. We all understand what it's like in a healthcare institution, in a healthcare setting, right? You have so many things to do and then great new ideas to sort of try and change the way care is delivered or paid for. And you got to implement them. Implementation is really hard. Relatively speaking, policy is easy. So that's what I cover on the policy stack, and also look at, things happening at the state level and the federal level. And I've been in the federal government before and, worked in that role. And so I get to bring that perspective to the podcast as well. But yeah, I think policy is pretty important, and it gets applied different ways at different levels, different administrations, different political ambitions. Those things all come into it.
Yeah. So Brian, you've talked about the move to value, and we've talked about that as an industry for some time. It's been hard to achieve outside of these pilots and demos. Lisa, you've talked about your experience with policy and how that can change things. But here's the rub. I thought technology was all going to save this here, especially here in 2026. So I really want to hear from Mike about this whole thing called artificial intelligence and how that's going to save the day.
Yeah, and if you've read, Abhinav's book on the autonomous healthcare, AI is the enabler of this autonomous healthcare business. And it's not super science fiction. It's not missions to Mars, although those are cool. It's not robots doing everything. It's more like we need to organize our systems so they work together. We've been our own worst enemy in healthcare. For the last 30, 40 years, we've been building one-off apps to solve particular problems that have an entire system, an ecosystem of data underneath it. And we've just created this big buildup of kind of a data mess. And so the promise of AI is it can help us clean that mess up, and we can use it to kind of advance some of these technologies, to get to the point of autonomous care. Because autonomy is about getting all the boring, mundane, administrative things out of the way of the clinicians so they can deliver the best outcomes possible.
And I would think that would bring costs down. Wouldn't that be correct, Dave?
Yes, if we pay for best outcomes at the lowest cost and use technology to help achieve that, absolutely.
I used to go into IT shops, worked at a number of IT organizations. I used to call it the golden treasure chest. One of the places I would automatically first go is into the data basement and figure out how discombobulated that system is. And there's money hidden. I mean, literally in a larger system, hundreds of administrative, repeatable tasks that can easily be replaced by automation, including AI. I'm not sure we have robots going around picking up the faxes and taking them over to a scanner, but maybe that helps too someday.
Yeah,
that's one of the bad. That's one of the bad things. One of the bad futures we could imagine here is we just replace ourselves with robots who pick up the faxes, right? Let's not do that.
Let's automate crappy processes,
Well, I
ideally not.
Brian,
oh, sorry, go ahead.
No, Brian, as a clinician, how do you think about how technology is going to help with this?
I think that it's a scenario where we've made things so bad that people are desperate for anything. And so it is a little bit like we are creating robots to go pick up the fax, but you're happy to have the robot pick up the fax when you don't have to pick up the fax. So
why are we even using faxes? That's a whole nother story. So Dave, Mike made some really cool points. Autonomy. autonomous healthcare, and how do we reduce the administrative costs? Like, how does a finance person, you've had a legacy, right? As a investment banker and working in healthcare your entire career, like, how does a finance person react to that?
Well, the finance people, it's almost impossible to overstate in the typical provider environment how important maximizing revenues by getting paid as much as possible for doing as much volume as possible, how that drives the enterprise. An old friend of mine, I used to be a CFO, and then he became CEO of Advent Health, Terry Shaw, just retired, said healthcare has always been and continues to be a cottage industry. It's just that we've turned the cottages into hotels. And I think he's exactly right. So the policy initiative I am most excited about is the push under, it's been several administrations, including when Lisa was in the Biden administration, but the push under the Trump administration right now to get full health data interoperability by mid-2026. And we can't get autonomy without interoperability. They go together like love and marriage. And like the song says, you can't have one without the other. We can't get the benefits of autonomy without health data interoperability. And the government doing what the government should do is forcing that. So I think once we have full health data interoperability, Mike's machines can go in and clean up the mess, and we can start to get systems that not only make sense of data, but actually act on that data where it's appropriate. And you can step up different levels of autonomy all the way to self-driving at some point for some things like pharmacy. But that's what we're on the cusp of. And this is where policy, finance, value, and technology come together. It's really exciting.
And I think, Dave, I just kind of continue on that point with autonomy from a technology perspective. You talked earlier about aligning incentives. We can align some of these incentives to encourage interoperability because there's other steps. We love the prior APIs. It's a fantastic first step. But there's other things we need to do beyond that. We need shared ontology. We need agreement on how do we persist this data? Very much like happened in some of the other industries. I was in the travel and hospitality industry. Well, we had an agreement on how we persist this data. And you get that today. You can walk up to TSA and you don't even need to pull out your ID now. We could get to that point in healthcare, but we need to get those further agreements. And then the other thing, so I just don't sound 100% like Mary Poppins and technology can take care of all these issues. It's super important that we also create the right guardrails going forward. It's, you hear about all the, doomsday scenarios with AI and, now we're going to put everything up in space and it's going to turn into Skynet. Well, we need guardrails for all these toolings, whether it's doing administrative things or it's getting to the point where it can drive your car without you having to even look out the window. We need guardrails, especially in healthcare, about how we, from a policy perspective, implement these tools and technologies. And so it's just important that we get this great technology as we define how we can use them and where we cannot, and importantly, where we cannot use them.
So that's the series. 4 conversations, 4 podcasts a month, one for each of these incredibly important aspects of healthcare transformation. So we've got Dr. Brian Silverstein, a legacy career as a consultant to many of the top health systems in this country, helping them set up their value-based care programs, helping to develop clinically integrated networks for them, and thinking very closely with the government and our collaborative partners in private sector to think about how do you really transform into value. We've got Lisa Berry, a legacy in government at CMS, thinking about AI, interoperability, and the transformation needs from a policies perspective, and an expert and world-class leader in interoperability and the needs to really start sharing data in this country. Got Mike Sutton, a legacy technologist who spent time in the travel industry, expanding Royal Caribbean from 5 to 50 ships. He really knows how to scale. Time at the CIA as deputy CIO and knows privacy, security, and guardrails more than anybody else in the industry. and then at Kaiser Permanente, the largest integrated health system in the country, as Chief Technology Officer. And then most importantly, David Johnson, because we got to finance this thing, who actually spent his entire career putting together health systems, learning how to do mergers and acquisitions as a investment banker, and then realizing he has to do penance for his time and figure out how do we transform financially into value. Isn't that right, David?
Absolutely right. I couldn't do it anymore. I was contributing the overbuilding of the acute care footprint in the country. And I'm sorry. People, I'm sorry.
So think about the connections this group has. We're going to have an incredible guest list. We're going to bring in the people that are truly doing the work, not just people that hypothesize or think about overall strategy without doing the hard work and getting into the disagreements. So stay tuned. You'll know what you're in for. And we're going to learn a lot during this important year, 2026, about how to transform healthcare from the people doing it.
Awesome. Looking forward to it.
Sounds great.
All right. See you later.
Adios.